Peri-implantitis is a condition that affects dental implants, characterized by progressive bone loss around the implant and inflammation of the surrounding soft tissues. Unlike other oral health issues, peri-implantitis specifically targets the area where the implant meets the bone, starting at the coronal portion and moving downward. The lower, or apical, part of the implant often remains firmly attached to the bone, a process known as osseointegration. Importantly, the implant usually does not become loose or mobile until the disease has advanced to later stages. Understanding peri-implantitis is crucial for anyone with dental implants, as early recognition and intervention can help preserve both the implant and overall oral health. The onset of peri-implantitis is subtle. It typically starts at the uppermost part of the dental implant, known as the coronal portion. Here, inflammation and bone loss begin to develop, while the deeper, apical portion of the implant remains securely integrated with the bone. This means that, in the early stages, patients may not notice any movement or instability in their implant. The disease can progress quietly, making regular dental checkups essential for early detection. Recognizing the initial site of peri-implantitis helps dental professionals focus their examinations and interventions where they are most needed. One of the distinguishing features of peri-implantitis is that the dental implant does not become mobile until the disease has reached an advanced stage. In the early and moderate phases, the implant remains stable because the lower part is still anchored in healthy bone. Mobility is a late sign, indicating significant bone loss and a compromised implant. This is why relying solely on implant movement to detect problems can be misleading. Regular monitoring and attention to other symptoms are necessary to catch peri-implantitis before it causes irreversible damage. A common clinical feature of peri-implantitis is a noticeable change in the color of the gums surrounding the implant. Healthy gums are typically pink, but inflammation can cause them to appear red or even purplish. These color changes are often accompanied by swelling and tenderness. Dentists look for these visual cues during routine examinations, as they can be early indicators of underlying problems. Paying attention to gum color changes can help patients and professionals alike catch peri-implantitis before it progresses. Bleeding upon gentle probing is another hallmark of peri-implantitis. When a dental professional gently probes the tissues around the implant, bleeding indicates inflammation and possible infection. This sign is similar to what is seen in gum disease around natural teeth. Bleeding on probing is a reliable and easily observed clinical feature, making it a valuable tool for early diagnosis. Patients should not ignore bleeding gums, especially around implants, as it may signal the onset of peri-implantitis. As peri-implantitis progresses, pockets may form between the implant and the surrounding gum tissue. These pockets are spaces where bacteria can accumulate, further fueling inflammation and bone loss. Dentists measure pocket depth during routine checkups to assess the health of the implant site. Deeper pockets are a sign that peri-implantitis is advancing and that more aggressive intervention may be needed. Monitoring pocket formation is a key part of managing implant health. Radiographs, or dental X-rays, are essential for detecting bone loss around implants. Peri-implantitis often causes visible destruction of the bone on radiographs, even before symptoms become obvious. Dentists use these images to track changes over time, comparing current bone levels to previous records. Early detection of bone loss on radiographs can prompt timely intervention, potentially saving the implant and preventing further complications. Suppuration, or the presence of pus, is a clear sign of infection around a dental implant. This, along with swelling of the surrounding tissues, indicates that peri-implantitis has progressed beyond mild inflammation. Suppuration is often accompanied by discomfort and may be noticed by the patient as a bad taste or odor. Swelling can make the area tender and more difficult to clean, further exacerbating the problem. Addressing these symptoms promptly is vital to prevent further damage. Calculus, or tartar, can accumulate around dental implants just as it does around natural teeth. This hardened plaque provides a surface for bacteria to thrive, increasing the risk of peri-implantitis. Regular professional cleanings are necessary to remove calculus and maintain a healthy environment around the implant. Patients should also be diligent with their oral hygiene routines to minimize buildup and reduce the risk of inflammation and infection. Mobility of a dental implant is a significant finding and can indicate both early and late failures. In the context of peri-implantitis, mobility usually appears in the later stages, when bone support has been severely compromised. However, detecting even slight movement early on can help identify problems before they become severe. Dentists use specialized instruments and techniques to assess implant stability during routine visits, making this an important part of ongoing implant care. Diagnosing peri-implantitis involves a combination of clinical assessments. Dentists evaluate oral hygiene, the condition of the marginal tissues, and the interface between the bone and the implant. These parameters are similar to those used in diagnosing periodontal disease around natural teeth. By systematically checking these areas, dental professionals can identify early signs of peri-implantitis and tailor treatment plans accordingly. Probing around dental implants is a key diagnostic tool. Successful implants typically allow a probe to penetrate about 3 to 4 millimeters into the tissue. The bone level is expected to be roughly 1 millimeter below the tip of the probe. Monitoring probing depth and clinical attachment levels over time helps dentists detect changes that may indicate peri-implantitis. Consistent measurements are essential for tracking disease progression and evaluating treatment effectiveness. Radiographic imaging, especially periapical intraoral radiographs, is a cornerstone in diagnosing peri-implantitis. These images allow dentists to visualize the bone surrounding the implant and detect even subtle changes in bone levels. Comparing current radiographs with previous ones helps track the progression of bone loss. Radiographs are non-invasive and provide valuable information that cannot be obtained through clinical examination alone. Monitoring the microbial environment around dental implants provides insights into the health of the tissues and the risk of peri-implantitis. By analyzing the types and quantities of bacteria present, dental professionals can tailor preventive and therapeutic strategies. Microbial monitoring is especially useful in patients with a history of periodontal disease or those showing early signs of implant complications. Implant failures can occur at different stages. Early failures happen soon after the implant is placed, often due to issues like improper site preparation, bacterial contamination, or inadequate mechanical stability. Late failures, on the other hand, develop after the implant has been restored and is in use, typically resulting from excessive load or infection such as peri-implantitis. Understanding the timing and causes of failure helps guide both prevention and management strategies. Early implant failure is most often linked to problems that occur during or immediately after the placement of the implant. These include improper preparation of the implant site, bacterial contamination during surgery, insufficient mechanical stability, and premature loading of the implant before it has fully integrated with the bone. Addressing these factors is essential for ensuring the long-term success of dental implants. Late implant failure typically arises after the implant has been restored and is in function. The most common causes are excessive mechanical load on the implant and infections such as peri-implant mucositis or peri-implantitis. These issues can develop over time, often due to changes in oral hygiene, bite forces, or the presence of chronic inflammation. Regular follow-up and maintenance are key to preventing late failures. Occlusal therapy involves analyzing the fit of the dental prosthesis and adjusting the bite to ensure that excessive forces are not placed on the implant. This process, known as occlusal equilibration, helps distribute chewing forces evenly and reduces the risk of mechanical complications. Proper occlusal therapy is an important part of both preventing and managing peri-implantitis, especially in patients with a history of bite problems. Managing peri-implantitis requires effective anti-infective therapy. This includes local plaque removal using plastic instruments or pumice, subgingival irrigation with chlorhexidine, and sometimes systemic antimicrobials for about 10 days. Patient compliance with oral hygiene is critical for success. It's important to avoid conventional steel or ultrasonic instruments, as these can damage the implant surface. Newer technologies like soft lasers are showing promise in improving outcomes. Effective plaque removal around dental implants is essential for preventing and managing peri-implantitis. Plastic instruments and pumice are recommended for cleaning, as they are gentle on the implant surface. Conventional steel or ultrasonic instruments should be avoided because they can scratch or damage the implant, increasing the risk of bacterial colonization. Regular professional cleanings and patient education are key components of successful plaque control. Subgingival irrigation with chlorhexidine is a widely used method for reducing bacterial load around dental implants. This antiseptic solution helps control infection and inflammation, making it an important part of anti-infective therapy. Chlorhexidine irrigation is typically performed in the dental office, but patients may also be instructed to use chlorhexidine rinses at home as part of their daily oral hygiene routine. In some cases, systemic antimicrobials are prescribed for about 10 days to help control infection associated with peri-implantitis. These medications work throughout the body to reduce bacterial levels and support local treatments. However, their use should be carefully considered and tailored to each patient's needs, as overuse can contribute to antibiotic resistance. Patient compliance with oral hygiene instructions is a cornerstone of peri-implantitis management. Daily cleaning with soft, rounded bristles, minimally abrasive toothpaste, and interproximal cleaning tools like gauze, superfloss, or irrigators is essential. Consistent and thorough home care helps prevent plaque accumulation and reduces the risk of infection, supporting the long-term health of dental implants. Soft lasers are an emerging technology in the management of peri-implantitis. These devices can help reduce bacterial load and promote healing without damaging the implant surface. While more research is needed, early results suggest that soft lasers may be a valuable adjunct to traditional anti-infective therapies, offering a gentle and effective option for patients with peri-implantitis. When non-surgical treatments are not enough, surgical techniques may be used to manage peri-implantitis. These procedures aim to achieve reosseointegration, or the reattachment of the implant to the bone. Surgical approaches are often adapted from techniques used to treat bone defects around natural teeth, but are modified to suit the unique challenges of dental implants. Success depends on careful planning and execution by experienced professionals. Ongoing maintenance is essential for the long-term success of dental implants. Patients should return for recall visits every 3 months, during which the dentist will monitor the health of the implant, check for signs of infection, and perform professional cleanings. Regular recall helps catch problems early and allows for timely intervention, reducing the risk of implant failure. Cumulative interceptive supportive therapy is a proactive approach to implant maintenance. This strategy involves regular monitoring and early intervention to address any signs of infection or inflammation before they become serious. By catching problems early, dentists can provide targeted treatments that help preserve the implant and surrounding tissues. Choosing the right oral hygiene tools is vital for implant care. Soft, rounded bristled toothbrushes, minimally abrasive toothpaste, and specialized interproximal cleaning aids like gauze, superfloss, or irrigators are recommended. These tools help remove plaque without damaging the implant surface, supporting both prevention and management of peri-implantitis. Cleaning between the teeth and implants, known as interproximal cleaning, is crucial for removing plaque and preventing peri-implantitis. Tools like gauze, superfloss, and oral irrigators are effective for reaching areas that toothbrushes may miss. Incorporating these aids into daily oral hygiene routines can significantly reduce the risk of infection and maintain implant health. Using minimally invasive, non-abrasive toothpaste is recommended for patients with dental implants. Abrasive toothpastes can scratch the implant surface, making it easier for bacteria to adhere and increasing the risk of peri-implantitis. Choosing gentle products helps protect both the implant and the surrounding tissues, supporting long-term oral health. Educating patients about peri-implantitis and proper oral hygiene is essential for prevention and management. Understanding the risks, recognizing early signs, and knowing how to care for implants empowers patients to take an active role in their oral health. Regular communication between patients and dental professionals ensures that any issues are addressed promptly. Regular professional monitoring is a cornerstone of implant maintenance. Dentists and hygienists use a combination of clinical exams, probing, radiographs, and microbial assessments to track implant health. Scheduled visits every 3 months allow for early detection of problems and timely intervention, greatly improving the chances of long-term implant success. Protecting the surface of dental implants is critical for preventing bacterial colonization and peri-implantitis. Using appropriate cleaning tools and avoiding abrasive materials helps maintain the integrity of the implant. Patients should follow their dentist's recommendations closely to ensure the longevity of their dental implants. Recall visits every 3 months are recommended for all patients with dental implants. These appointments allow dental professionals to monitor the implant, perform professional cleanings, and reinforce oral hygiene instructions. Regular recall is a proactive step that helps prevent peri-implantitis and ensures the long-term success of the implant. Supportive therapy involves ongoing care and monitoring to intercept and manage any issues early. This approach includes regular checkups, professional cleanings, and patient education. By staying proactive, both patients and dental professionals can work together to maintain healthy implants and prevent complications. Peri-implantitis is a specific inflammatory condition affecting the tissues and bone around dental implants. It is characterized by progressive bone loss and soft tissue inflammation, which, if left untreated, can lead to implant failure. Early detection and management are crucial for preserving implant function and oral health. Osseointegration refers to the direct structural and functional connection between living bone and the surface of a dental implant. This process is essential for implant stability and long-term success. In peri-implantitis, the coronal portion loses bone support, while the apical portion often remains osseointegrated until late stages. Probing depth is the measurement of the distance from the gum margin to the base of the pocket around an implant. It is a key parameter in diagnosing peri-implantitis, with increased depths indicating disease progression. Accurate probing helps track changes and guide treatment decisions. Supportive therapy refers to ongoing maintenance and monitoring designed to prevent peri-implantitis and other complications. This includes regular dental visits, professional cleanings, and patient education. Supportive therapy is essential for the long-term health of dental implants. Anti-infective therapy encompasses all measures aimed at reducing or eliminating bacterial infection around dental implants. This includes local plaque removal, antiseptic irrigation, and systemic antimicrobials. Effective anti-infective therapy is a cornerstone of peri-implantitis management. Surgical re-osseointegration is a technique aimed at reattaching the implant to the bone after peri-implantitis has caused bone loss. This approach is adapted from periodontal surgery and requires careful planning and execution. Success depends on removing infection and creating a stable environment for bone healing. Microbial monitoring involves assessing the types and levels of bacteria around dental implants. This information helps guide preventive and therapeutic strategies. especially in patients at higher risk for peri-implantitis. Regular microbial monitoring supports personalized care and better outcomes. Maintenance recall refers to scheduled follow-up visits, typically every 3 months, for patients with dental implants. These visits are essential for monitoring implant health, performing professional cleanings, and reinforcing oral hygiene practices. Maintenance recall is a key part of long-term implant success. Interproximal cleaning refers to the removal of plaque and debris from the spaces between teeth and implants. Tools like gauze, superfloss, and irrigators are used to maintain cleanliness in these hard-to-reach areas. Effective interproximal cleaning is vital for preventing peri-implantitis. Peri-implantitis is a serious condition that can compromise the success of dental implants if not detected and managed early. Key features include progressive bone loss, inflammation, and late-stage mobility. Diagnosis relies on clinical exams, probing, radiographs, and microbial monitoring. Management combines anti-infective therapy, surgical techniques, and strict maintenance. Patient education and regular recall visits are essential for prevention. By understanding and addressing peri-implantitis, both patients and dental professionals can ensure the long-term health of dental implants.